Welcome to Next Level Academy, Step Up Your Career. Today we are going to see the JIPMA skill test questions asked on February 1, 2023. Students, today we are going to see IM injection. Before that, we are going to see the angle of injections given. First is intramuscular, which is given in the muscular layer at the 90 degree. A good example is TT injection. And next is subcutaneous. This is given at the subcutaneous tissue level at the 45 degree angle. Uh, is a good example as insulin, heparin, and next is intravenous, which is given in the venous supply. It is given in the directly to the blood supply. And a good example are like any IV fluids and antibiotics and the transfusion. And next is intradermal, which is given in the dermal layer of the skin, which is given at the angle of 10 to 15 degree, like tuberculin test and any local anesthesia or any allergic testing injections. It's all given in the intradermal. Now we are going to see IM injection. One of the IM injection site is dorsogluteal. The dorso, which means the backside. Gluteal is the gluteal area of the body. And next is the patient is actually asked to lie on the prone position, and the in the gluteal area is the gluteal muscle where an imaginary line which is drawn dividing four quadrant, and in the upper outer quadrant it's chosen, and you have to make another imaginary line, or you can keep your two fingers, index and the middle finger, palpating the index finger at the crest of the ilium or the iliac crest, and you have to make a V shape, and at the point of the midpoint you have to choose that's the site of the IM injection, because it is a high muscular area. So this site is majorly chosen because it is the safest site. And next we are going to see the deltoid site. So deltoid site is nothing but the shoulder. You have to palpate the acromion process, and you have to take two fingers. If the patient is lean, you can take two fingers. If the patient is fatty, you can take three fingers. So the third finger or the second finger, if it is lean patient, that is the injection site where you have to give IM. And next is ventrogluteal. Ventrogluteal is nothing but, mostly this site is not preferred, but I have to explain this. Is you have to palpate with the middle finger, the iliac crest, and you have to take a V shape with the index finger. You have to palpate the anterior superior iliac spine of the with the index finger, and at the proximal point of the finger is the injection site. And next is the vastus lateralis. Vastus lateralis is nothing but vastus lateralis is actually a muscle. So where this injection is actually preferred for children, that's infant, because that's the muscular layer they have during that age group. So you have to choose the vastus lateralis. This is the middle part of the thigh, and towards the lateral side, you have to make the baby to turn at the lateral side, and it will be easy for you. And you have to take the outer middle third. Outer middle third. This is the middle part, okay, and this is the outer middle third. You have to that's the site for injection. So next we are going to see this device. Device is nothing but HME filter. HME filter is most commonly used in the ICUs for ventilator patient. HME, it means the abbreviation is heat moisture exchanger. So this exchanges the heat and moisture to the patient who are in the ventilator. So this is connected at the distal part of the ET tube, and the other end is connected from the ventilator tube. So what actually it does is it helps to reduce the mucus production and coughing by humidifying and filtering the air the patient breathes. so that the patient will not uh, have a dry airway. Next is pictal catheter. It itself self-explanatory. So this catheter, it is actually coiled at one end. So this is like a pig tail. This, what is the purpose of this big tile is nothing but, see, this purpose is the catheter purpose is nothing but they'll insert in the body wherever it is necessary. Okay, they'll not insert in the intercostal tube. That's because ICD intercostal catheter will be inserted over there. The other part of the body, wherever the exudate, the serous fluid or the sepsis, pus collection, which is actually collected in the body, if it has to be removed, so this catheter is chosen. So what it does is this catheter, it when it is inserted, this will get coiled inside and this will not get removed easily. So that is the purpose of this catheter, and it has a draining passage, okay, through which the bag is connected, and the drain will be collected over there and it will be measured. Next is tetanus toxoid injection, that's TT injection. This injection can be given by two routes. One is IM and IV. IM, if the patient is having mild laceration and mild abrasions, it can be given by IM. If the patient is having deep laceration and the patient is in need of an immunoglobulin, so in that occasion, the patient can be given TETGLOB, that is tetanus immunoglobulin. So the patient will have immune power immediately. And next is this TT also given during in the immunization schedule you might have crossed is diphtheria tetanus pertussis, that is TTP. It's given in 2 months, 4 months, 6 months, and also during the pregnancy time it is given. And also like adult can be taken every 6 months as a booster dose. So next is ankle bandage. Ankle bandage, it's colloquially you call it as, you might have heard as crab bandage. So which has elasticity. This bandage is wrapped up in the uh, ankle area. So this will be wrapped in such a way that this will prevent swelling, and also it will not make the muscle to move, and also this will give a good support to the ankle and also prevent from swelling and further injury. Next is high flow nasal cannula, HFNC. This is used for the patient who is having acute heart failure, acute respiratory distress syndrome, who is actually in need of improved ventilation and oxygen through a positive pressure environment. So this is actually this is the machine, okay, which was displayed in the skill test. Here, the humidifier, this humidifies the air, because otherwise the patient will have a dry air and that will rupture the airway tract. So this has a nasal cannula by which the patient will take the um, oxygen flow. So it provides a high positive air pressure, so through which the patient will have a good ventilation of air. This is non-invasive ventilation, okay, mask, and this is nasal high flow. Next is transducer. Transducer, this is actually, it is used in the ICU setup. You might have seen the BP curve, which is connected with the monitor in the patient. This gives an approximate measurement of the blood pressure. With this transducer, it gives an accurate measurement of the blood pressure. This is connected with the transducer is a kit. It's a device which is connected with a syringe and with the saline, and this will be connected with the patient through the arterial pressure, arterial arterial cannula, and this cannula will read the arterial pressure, which has an accuracy, 100% accuracy of the blood pressure. Next is Vicryl suture material. This Vicryl suture material, this is actually used as to suture the small intestine, large intestine, peritoneum, muscle, and even subcutaneous tissues, like which are the suture has to be sutured interiorly. So this Vicryl is used. Thank you, students. I hope I have explained you properly and you have understood. Please like, share, subscribe. Thank you, and please subscribe Next Level channel.